Facing a global health crisis unlike any in the 75-year history of the United Nations, Secretary General Antonio Guterres today, or on March 19, called for a coordinated, decisive, and innovative policy action from the world's leading economies. Watch this.
Unprecedented situation. We are facing a global health crisis, unlike any in 75-year history of the United Nations. One that is spreading human suffering, infecting the global economy, and upending people's lives. A global recession, perhaps of record dimensions, is a near certainty. This is above all a human crisis that calls for solidarity. Our human family is stressed and the social fabric is being torn. People are suffering, sick and scared. And current responses at the country level will not address the global scale and complexity of the crisis. This is a moment that demands coordinated, decisive and innovative policy action from the world's leading economies. We must recognize that the poorest and most vulnerable, especially women, will be the hardest hit. I welcome the decision by G20 leaders to convene an emergency summit next week to respond to the epic challenges posed by the COVID-19 pandemic, and I look forward to taking part. We are in an unprecedented situation, and the normal rules no longer apply. We cannot resort to the usual tools in such unusual times. The creativity of the response must match the unique nature of the crisis, and the magnitude of the response must match its scale.
He highlighted 3 critical areas for action: tackling the health emergency, focusing on the social impact and the economic response and recovery, and thirdly, a responsibility to recover better.
Of the world, it would kill millions of people. As we need to immediately move away from a situation where each country is undertaking its own health strategies to one that ensures in full transparency a coordinated global response, including helping countries that are less prepared to tackle the crisis. Governments must give the strongest support to the multilateral effort to fight the virus, led by the World Health Organization, whose appeals must be fully met. Most fundamentally, we need to focus on people, low-wage workers, small and medium enterprises, the most vulnerable. And that means wage support, insurance, social protection, preventing bankruptcies and job loss. And that also means designing fiscal and monetary responses to ensure that the burden does not fall on those who can least afford it. The recovery must not come on the backs of the poorest, and we cannot create a legion of new poor. We need to get resources directly in the hands of people. Children are also paying a heavy price. More than 800 million children are out of school. Right now, many of whom rely on school to provide their only meal. We must ensure that all children have access to food and equal access to learning, bridging the digital divide and reducing the costs of connectivity. A responsibility to recover better. The 2008 financial crisis demonstrated clearly that countries with robust social protection systems suffered the least and recovered most quickly from its impact. We must ensure that lessons are learned and that this crisis provides a watershed moment for health emergency preparedness and for investment in critical 21st century public services and the effective delivery of global public goods. We see that whenever there is a problem in the banking system, trillions appear to solve the problems of the banks. And these trillions must appear now. Governments, central banks must work to guarantee that there is liquidity in the economy, but also that funds are mobilized to those that are most in need. And those that are most in need are people, on one hand, and the poorest countries on the other. And it is absolutely essential to show solidarity in the way we respond to the crisis.